Welcome all. Welcome to this AimExcellence NRMT question answer discussion. The question is pretty interesting and important one. Recent outbreak in Kerala cost 10 lives. Investigation of choice to detect a case infected with Nipah virus. So is it A. Immunohistochemistry? Is it B. IgM ELISA? Is it a C. IgG estimation? Or is it going for the real-time polymerase chain reaction? So first see where we are going to do the immunohistochemistry. It is to confirm the diagnosis in an autopsy specimen. So this is certainly not the investigation of the choice. IgM and IgG ELISA studies are done to confirm the diagnosis in a person who have recovered from the Nipah virus infection. So these also are not the investigation of choice. Investigation of choice is real-time polymerase chain reaction. Now the important thing is why this Nipah virus is important. Because of its fatality rate. It is seen since the first outbreak in Malaysia, 54% fatality rate in various outbreaks across the globe. The fatality rate is 54%, and that is the area of concern. The clinical presentation is quite a various. It ranges from asymptomatic to respiratory infections, and also encephalitis. Now, the encephalitis is causing the most of the fatality. The case can be fatal since the full-blown infection within 24 to 48 hours, and that is where it is important to diagnose the case early, and that is where real-time PCR will help. But there is no standard treatment till now, no drug of choice. Though ribavirin and chloroquine have shown some encouraging result in preventing the infection, ribavirin and chloroquine. So to prevent the nosocomial infection, which can be spread through respiratory droplets, standard infection control. This is standard infection control that is actually employed like many other infectious diseases. Standard infection control. So till now we understood this is a RNA virus, Nipah virus, which is actually from the Nipah genus Nipah virus. The main host is in various outbreaks is fruit bats are fruit bats, some occasional hosts are pigs. This is a zoonosis which is infecting both animals and human being too. No vaccine yet developed to control the infection, and physicians and nurses and the laboratory attendants are at the higher risk. So these are the important points considering this is a infection with high fatality rate and have recently happened in India in the upcoming examination. Also, as because it's a updated in the WHO websites too, so this can be a question from the USMLE perspective too. If you like this particular presentation and have any queries regarding this particular presentation, write to Facebook pages message boxes like previous queries. Also, we are going to get back to you within 72 hours, and continue to be with us in the Facebook, Twitter and YouTube. Thank you.